Chapter 29, Over-the-Counter Medications. In the beginning of every chapter, we have the terms and definitions. These definitely should be something that you focus on when you're studying and reading through the chapter yourself. We will talk about them in this lecture as we go through it, so I will skip them for now. We all should know what over-the-counter medications are. Medications that you can just buy off the shelf without a prescription, without your doctor, without any medical professional's opinion or guidance. In the pharmacy world, the pharmacist can provide therapeutic advice, recommendations for certain ailments, stuff of that nature. As pharmacy technicians, we can never give patient recommendations about medication. So we will never do that. Even if we think we know a good remedy, we would never tell them that. This paragraph basically talks about, as pharmacy technicians, our main job is going to be maybe showing them where the products are. They might come up to the pharmacy counter and ask where something is. You're going to just quickly go out and show them. Even if the patient talks to the pharmacist and then the pharmacist recommends something, more than likely you're going to be the one that goes and shows them where the medication is, especially if you're really busy, because in the retail world, you have less pharmacists than you do technicians working. So it makes more sense for us to leave the pharmacy versus the pharmacist, even just for a little bit. Consumer access to OTC drugs has increased sharply since the mid-80s. The Consumer Healthcare Product Association offers useful data on OTC sales, possible healthcare cost declines, and the future of these products. They cite 4 broad reasons that patients use OTC drugs: accessibility, affordability, trust, and empowerment. In this chapter, we will explore recommended OTC drugs and present common dose forms and dosages. We will also talk about the FDA rules. Federal law dictates that pharmacists counsel Medicaid patients receiving new prescriptions. Individual states have added counseling expectation. Unless the prescriber writes a script for the non-prescription item, that does not fall under these categories. Because, of course, if you're a Medicaid patient and not informing the pharmacist that you're purchasing something, how would they know? The ready availability of OTC drugs can provide cost savings, but it can also pose risk if it's excluded from the patient's profile in the pharmacy. OTC medications interact with prescription medications and medical conditions. It is important that we have all of that information. What should consumers consider in choosing OTC medications? Well, they need to correctly identify the etiology or cause of the disease. That's the first step. If the diagnosis is wrong, the non-prescription medication may aggravate an underlying condition. Many OTCs list specific age groups that should not take the medication. Parents should consult with their children's pediatrician before giving them medications that are over the counter, especially to children younger than 4 years old. Children with colds may develop ear infections and other conditions that warrant a visit to the pediatrician. Consumers should address these considerations before buying and using OTC medications. Various OTCs have identical ingredients. However, consumers often buy a more expensive name brand, not realizing that they're getting the same medication as the less expensive generic form. Manufacturers may swap like ingredients. If you look at the label for different OTCs, you might see different inactive ingredients. The active ingredient, which is the medication, is going to be the same. Excuse me. Patients on special diets with allergies, diabetes, or interacting medications should use caution in selecting an OTC. Parents should double check with the pharmacist when buying non-prescription medications for infants or young children. And when trying a new agent, you should watch carefully for any adverse reactions that may occur. Pregnant or nursing women cannot take many prescription and non-prescription medications. And pregnant or breastfeeding women should always seek professional advice before taking an OTC product. And the pharmacist is going to tell them that 100% if they come and ask a question about something. The FDA regulates OTC and prescription medications differently. New drugs must undergo a new drug application before approval. Drugs judged, generally recognized as safe and effective, are exempt. Historically, some drug products, such as aspirin, were available OTC before the NDA. To handle these products, the FDA has set up an OTC monograph system. This method allows expert panels to review OTCs for the Gray's label. A RX to OTC switch. So how a prescription drug becomes an over-the-counter drug. This takes place through one of two methods, under the OTC drug review or through manufacturer submission of added information to the original product's NDA. This has happened many times since I have been in the pharmacy world, starting with Claritin, Zyrtec, Allegra. Most of your allergy medications that were once prescription are now over the counter. Acid reflux medication like Prilosec and Nexium are now over the counter, and there's even some nasal inhalers like Flonase that's over the counter now, and many more things to come, I'm sure. So the FDA's main concern is whether patients can safely use the medication without a healthcare provider's oversight. OTC drug approval has similar safety and effectiveness standard as those placed on legend drugs, which are drugs that need a prescription. So over-the-counter drugs, and then we have legend drugs. A prospective non-prescription formula may have a lower dosage than its prescription counterpart. Studies must confirm its effectiveness at the new dosage. If the agent meets the standards, the FDA will likely approve the medication. Here are some more notable agents. I kind of already went over them a little bit. So Claritin, Allegra, Zyrtec, your non-sedating antihistamines. Proton pump inhibitors like omeprazole, Prilosec, Nexium, and Prevacid, all for GERD or acid reflux. We have Miralax, that is a laxative that's over the counter now. Some nasal sprays, as I said, Rhinocort, Flonase, and Nasacort. There is also a patch for overactive bladder that is called Oxytrol that is over the counter. This chart is common OTC drug products, the symptoms they treat, and the route of administration. For acne products, we're treating pimples. We're going to usually apply topical. There is some antibiotics, though, that are given for acne orally. Analgesics, they're for pain. We're going to have oral, topical, and rectal. Antacids for indigestion. Those are going to be oral. Antibiotics for topical infection treatment and prophylaxis. So there's no antibiotics over the counter to treat bacteria orally. They're referring to Neosporin or bacitracin or polysporin, the triple antibiotic creams, or the poly is 2 different antibiotics. Those are what they're talking about. Those are topical. For antidiarrheals, we're obviously treating diarrhea. Those are going to be oral. And then we have antifungals, topical. So the foot section, you can usually find most of the antifungals for athlete's foot, ringworm, things of that nature. Antihistamines treat allergies. We have oral and intranasal routes of administration. Anti-inflammatories that treat inflammation or arthritis pain are going to come in oral and topical. Antipyretics that treat fevers, again, are going to be in oral and rectal. Cold sore preparations that treat painful canker sores will be topical. Cough suppressants that treat dry coughs will be oral. Decongestants that will treat congestion are available as oral and intranasal. Expectorants that treat a productive cough are oral. Headache products that treat pain are oral. Laxatives that treat constipation can be oral or rectal. Sleep aids that treat insomnia, oral. Sore throat products that treat pain, oral. And sunburn products for pain and inflammation are topical. Sunscreens for sunburn prophylaxis. So prophylaxis means treating something before it happens. And then wart removal products, which are topical. Over-the-counter pain relievers and antipyretics are going to be Tylenol and aspirin. So they relieve pain. Analgesics relieve pain, and antipyretics reduce fevers. Acetaminophen, which is the generic for the brand name Tylenol, is both an analgesic and an antipyretic. Aspirin, which you'll see commonly referred to as its generic name, acetylsalicylic acid. I would remember that. That is definitely something that might come up on the PTCB related to, not just asking what it is, but relating to it, and it might only list it like that. So just keep that in mind. So aspirin is an analgesic, an antipyretic, an anti-inflammatory at higher doses. Aspirin also comes in low dose or baby aspirin that can prevent platelet clotting to avoid heart attacks and strokes. This table is select OTC pain medication. So we have for non-narcotic, all of them are non-narcotics, but we have Tylenol for analgesics, and then for NSAIDs, non-steroidal anti-inflammatory drugs, we have aspirin, ibuprofen, and naproxen, which come in the brand names of Ecotrin, Advil, Motrin, and Aleve. A potential common side effect of NSAIDs is an increase in blood pressure. We should alert the pharmacist if the patient has blood pressure medications and OTC NSAIDs. Over-the-counter allergy treatments. These products can contain several agents such as antihistamines or decongestants. Antihistamines block histamine receptors, which cause allergic symptoms. Customers use antihistamine to reduce symptoms of pruritus, which is itching, hives, sneezing, itchy, and runny eyes. First generation sedating agents include diphenhydramine, the generic for Benadryl, chlorpheniramine, which is the generic for chlortrimeton, cetirizine, which is the generic for Zyrtec is a weekly sedating antihistamine that causes less drowsiness than first generation agents. So typically you should be able to take Zyrtec, Claritin, and be totally fine to go about your day. However, if you take Benadryl or chlorotrimazole, that might not be the case, depending on how used to taking it you are and stuff like that. OTC antihistamines can relieve mild symptoms of allergies, but severe allergies may need a prescription. We have our select OTC products for allergy symptoms in this table. So non-sedating antihistamines, again, we have Zyrtec, Allegra, Claritin. Those are all the brand name or the trade name. Oral sedating, again, we have chlorotrimazole and Benadryl. For decongestant, we have Sudafed, which is pseudoephedrine, and that has to be purchased only at the pharmacy counter. You won't actually find that out on the shelf. There is some nasal decongestants, such as Afrin and neosynephrine. And also, just to know, there is Sudafed PE that you can purchase out on the shelf without going to the pharmacy counter. But the generic name is phenylephrine and not pseudoephedrine. Pseudoephedrine is usually proven to work better, but it can cause an increase in blood pressure, and it is under the Combat Methamphetamine Act, so it has to be regulated, the sales. We have mast cell stabilizers, such as Cromolyn with the brand name of Nasal Crom. We have ophthalmic, so eye drops for allergies such as Zadiator. We have an antihistamine / decongestant eye drops like Clear Eyes or OptiClear. Then we have our nasal steroids such as Rhinocort, Flonase, and Nasocort that are over the counter. This chart is select OTC products for cough and cold symptoms. Again, antipyretic for fever. We have acetaminophen, also will help with pain, so it's an analgesic. We have ibuprofen, Advil. For cough suppressants, we have Dulcim, among other things. It's an antitussive. An expectorant, guaifenesin, is available as Mucinex. That's usually in tablet form. I think they have some liquid forms now. You will hear pharmacists recommend patients get Robitussin, which the active ingredient is guaifenesin, because it's usually much cheaper. There is a systemic decongestant, which we already talked about previously, Sudafed, pseudoephedrine, local anesthetics for cough and colds, the Chloraseptic sore throat lozenges. They have benzocaine in them, so they help really well with sore throats. You'll hear pharmacists recommend those quite a bit. There's still the Chloraseptic spray, Hall's lozenges, so just regular cough drops, Cepacol dual relief spray. And then for the antihistamine sedatings, we have diphenhydramine, which is Benadryl. Many customers treat insomnia with non-prescription products first. Effective first-generation sedating antihistamines include diphenhydramine and doxylamine. Some combination products also contain a pain reliever, such as acetaminophen, to help with nighttime aches. These sleep aids handle transient insomnia and are not for extended use. Melatonin is a nutraceutical widely used for sleep issues. The pineal gland secretes the endogenous hormone that plays a role in circadian rhythm. Select OTC products for insomnia include, of course, we just talked about melatonin, which is a hormone, a nutritional supplement, histamine antagonists, such as a first generation diphenhydramine or doxylamine. Unisom is, if you actually go to the store and flip over Unisom, you'll see that there is a version with diphenhydramine and with doxylamine. Select OTC products for gastroesophageal reflux disease and indigestion, so GERD, acid reflux. So we have antacids, which neutralize existing stomach acids, such as milk of magnesia and sodium bicarbonate. We have histamine 2 blockers, such as Tagamet, Pepcid, and Zantac. However, Zantac as ranitidine has been removed from the market. If you find Zantac on the shelf now, it will be famotidine. We have the proton pump inhibitors such as Nexium, Prilosec, and Prevacid. Then there's other over-the-counter medications for GI conditions such as constipation and diarrhea. We have fiber and bulk laxatives such as Metamucil, Colace for stool softening. We have a hyperosmolar agent, sorbitol. We have stimulants such as bisacodyl and senna, which are going to promote going to the bathroom. We have saline laxatives like magnesium citrate and magnesium hydroxide, which is milk of magnesia. We have mineral oil for lubricant laxative, glycerin suppositories, bisacodyl suppositories that will help you go to the bathroom. Enemas, such as fleet enemas, and then the fleet mineral oil enemas. And then for diarrheals, we have Imodium and Pepto-Bismol. Then we have select OTC products for a variety of skin conditions. So acne, benzoyl peroxide is going to be the number one thing prescribed over the counter, not prescribed, but recommended over the counter even by your doctor. So it comes in a bunch of different trade names. I don't know if all of these still are around, but there's Panoxyl. There's a few different ones that you would find in the moisturizing face section. Athlete's foot, we have Lotrimin, Zezorb, Tinactin, Lamisil. Here's all their generic names. For cuts and scrapes, we have the Neosporin, Bacitracin, and Neomycin. For highs and inflammation, Benadryl comes in a lotion or cream. Also, the tablets work for that as well. We have hydrocortisone over the counter, which is cortisone 10 is the brand name. So hydrocortisone over the counter is going to be a lot less potent than the prescription. And then we have salicylic acid, which is used for warts, which comes in a variety of different names like compound W, duofilm, and salisol. Elderly patients can have multiple conditions that make self-treatment risky. So we should definitely always check with our loved ones and make sure that they are letting their doctors and pharmacists know if they're purchasing anything over the counter. Another high-risk group would be infants and young children. Then we have restricted over-the-counter products, which I've already talked about, pseudoephedrine. So there's a logbook or electronic record containing customer's name, address, ID, and signature, date and time of sale, and name and quantity of products sold. These records are kept for at least 2 years and purchases are limited. And last but not least, we have the urinary incontinence for overactive bladder we talked about in the beginning. We have that patch. The brand name is Oxytrol for women. The generic name is oxybutynin, which we have available as a pill in the pharmacy. It is not over the counter. This is a patch, an anticholinergic patch to treat overactive bladder. The patch duration of action is 4 days, meaning so it's going to work 4 days, be on the patient for 4 days. And then, of course, side effects like dry mouth, constipation, and drowsiness, dizziness, or blurred vision, and they should avoid alcohol during treatment. After removing the patch, they might have some site-specific itching or redness. And make sure you review the key points before you're done with the chapter, and make sure that you understand all of the terms and definitions.